Good afternoon, everybody. My name is Jean Schensul. I've been an affiliate of CIRA since its inception, and today I'm going to be talking with you about part 2 of the Introduction to Qualitative Research Methods, hoping that you will find this useful in conjunction with part 1 in designing and carrying out your qualitative and mixed methods research. So I refer you to, for supplemental reading, I refer you to the Ethnographer's Toolkit, which is a set of 7 books that provide readers with an introduction to mixed methods research with an emphasis on qualitative research, and then entry into the field, essential and basic research methods, data analysis, ethics of research, a new book which has just come out, and the last book finally out in 2015 will be an exploration of ethnography in action with a special emphasis on using ethnography in intervention research. So let me move on now to the presentation. The first thing that I want to talk about in the second part of the Introduction to Ethnographic Methods is the importance of a research model. Most people, depending on what they read, come to qualitative research, or any research for that matter, with the idea that the approach is primarily inductive. I think that that's a risky approach to take for a variety of reasons. First of all, because when we decide on a research problem, we generally have good reasons for looking at considering the problem, and we also have some thoughts about what the components of the problem are because we've had some experience in the field, we've talked to other people about the situation, we maybe have done some informal interviews. So I like to suggest starting with a research model, which doesn't look very different from a typical deductive quantitative research model. Generally, the models that we suggest start with a dependent domain, or whatever the issue is of concern. Could be many things. It could be drinking among men who are HIV positive. It could be protection using PrEP, could be addressing TB in people who are exposed to HIV, and so on. The next step is to think about the possible factors in the setting that might contribute to that problem. And we like to do this in a multi-level way using an ecological model. I'll show you in a few moments an example of some models that would be exemplary of the approach that you might take. We consider that these first research models are formative. That is to say, they're just initial steps. They help to reduce bias. And if we're working with a team, constructing such a model is a way of developing common ground so that we all understand what we're talking about. These research models in the initial stages are based on literature, also on lived experience, best guesses, possible first visits to the field, and so on. But they're not based on nothing. In other words, we don't really go into the field anymore with a blank slate. We need to know something about the situation. As I said, the models can be participatory, and they may also include domains that everyone is interested in, but for which no measures exist at the time. These models must be validated by formative qualitative research and verified by quantitative survey research. We usually, I think all of us are familiar with ecological models. I'll just show you a couple of examples. The typical ecological model includes multiple levels, starting with the individual. Depending on who you read, maybe different types of social organizations that extend in social distance from the individual. Here, this particular model shows the individual, his or her interpersonal relationships with family, with friends, with social networks. The next level out is organizational, involving organizations, social institutions that the individual comes into contact with. Then the broader community in which those organizations exist, and many other factors as well. And then finally, public policy. We could also include media, how we develop and think about the different sort of contextual levels is dependent on the study. It's important to remember in an ecological model that these components all interconnect. So when we do our research, we usually do it at one point in time, and so we're not nowadays we're working hard to build dynamic models over time, but these models are primarily static. When they are dynamic, they need to include feedback loops and other characteristics of system dynamics research, which is not maybe the topic of another discussion. So here are some hand-drawn two examples of research model prototypes. They're extremely simple, at least in their initial stages. So on the left-hand side, the focus here, and then the dependent variable, is ART adherence in HIV. On the left-hand side, we see sort of a typical model that takes two levels, the peer level, the family level, and then adds a cognition and links them to each other and to ART adherence. Now, you have to remember that these are the largest possible domains. They're really domains in the ecological model, but we haven't begun to unpack them at all. We're not talking as yet about what it is about anything going on in the peer sector that might affect ART adherence, nor anything at the cognitive level that might affect it, or anything in the family that might affect ART adherence, either non-adherence or adherence. So those are the next steps in the development of the model, where we try to, at least in the formative stages, unpack those very large domains to see if we can generate some initial very formative hypotheses. Now, the model on the left-hand side is actually the bottom part of the model on the right-hand side. So we've just replicated that model, and we've added to that model some systems components. So for example, if we're looking at the treatment cascade, we're not just looking at the factors that prevent ART adherence in individuals, we're looking at systemic factors that contribute to problems in accessing treatments, staying in treatment, interacting with the healthcare system, and so on. So here I've just added, for sake of conversation, three main issues: staff turnover in the service provider sector, poor communication between providers and patients, and inefficient interorganizational cross-referring, all of which contribute to the system, the treatment cascade at the systems level, which in turn interacts with the factors contributing to ART at the individual level, to give us a more complex ecological model to study the treatment cascade and the important issues in ART adherence that go beyond the individual and the household. So let me go on now to talk about typical data collection methods that we use in qualitative and mixed methods research. In ethnographic research. I use ethnographic, by the way, to refer to mixed methods in community-like settings in which we are conducting a lot of face-to-face data collection, at least in the initial stages, then building our quantitative instruments and using a lot of supplemental data to try to help us understand the system. So let me just run through these, this list of typical data collection methods that are used in qualitative mixed methods research. First of all, observations and observation checklists. These can include open-ended observation, sometimes called participant observation, depending on how integrated the person is into the setting, and timed and checklist observations of specific events which look for presence and absence of known factors. So they're a little more systematic. We use different types of formal and informal maps, cognitive maps, body maps. We also use listings and PILESORTS to identify cultural patterns and cultural consensus or non-consensus in a population. We use many different cultural artifacts that serve oftentimes as elicitation tools for understanding how systems work and understanding what is meaningful to people, for example, in the environment. So I'll describe those a little later on. We also use many different kinds of interviews. There's not one kind of interview like the focus group. There are many different approaches to interviewing, individual and group. We use secondary data, which could be MIS data, clinic records. Oftentimes we use macro level data like DHS or the census data to provide background information on a community or institutional setting. We also use visual forms of documentation or audio-visual, including video, film, still photographs. And finally, we use what we call ethno-epidemiologic surveys, which are ethnographically based surveys that is based on what is known to be meaningful in the setting. So these surveys are built both inductively and deductively, and as we get to that point, I'll say a little more about it. A few words about observation. So observations can be conducted in an open-ended way. Again, because we have a research model, we don't conduct completely open-ended observations because we have a question in mind. So, but we also try to suspend judgment when we're observing in a setting that is unfamiliar to us or even familiar to us, to try to avoid forming judgments too early on. Open-ended observations can come at any time during a study, but generally they come in the initial stages when, for example, we're trying to understand where youth hang out. So we may walk or drive around a neighborhood just observing where there are clusters of 5 or 6 or 10 young people on street corners in front of different kinds of stores. We make a note of that, and eventually we see whether we can observe that pattern again and then come back to try to understand it by spending time observing in one of the sites where young people are hanging out. We might do timed observations, for example, in parks. We might want to see who uses the basketball court. So we would want to do that maybe in the morning, or the children's playground. In the morning, midday, early afternoon, late afternoon, and there we would keep track at each point in time of, who is there by age, by ethnicity, by gender, by type of clothing, what kinds of activities are going on, where they're going on in the playground or in the park. And then our question becomes, how do these patterns change over time in the course of a day or in the course of a week, and what explains those changes? We also use structured observations to try to understand, for example, in an intervention, whether what is intended to happen actually happens. So we might use a checklist, for example, in a counseling intervention. And at times, we can use cameras for observational purposes. One really good example of that was a study done by young people with an artist photographer using the camera to see how things change when your perspective is distant versus close up. So teens with cameras first took distant shots of a location in a park in Hartford, and then moved towards a mid-range position. And so they got a lot of green and shrubbery and open spaces in the distant shot. Then they moved closer and they saw some indication of garbage on the ground. And as they got very close to the garbage and closer to the green areas, they saw that that garbage consisted of discarded drug paraphernalia. So they actually did an exhibit of their photographs of these 3 contrasting perspectives on a single location. Now let me talk again about informal observation by describing a study that was done in India a couple of years ago. So where we were interested in learning about where men and women met and became or were likely to become involved in commercial sex transactions. So our study team mapped the community, identifying known locations like commercial sex work areas, and which were already known to anybody that was doing work or living in the area. Ladies' bars, which were bars that were in which women provided lap sex with men, and sometimes penetrative sex, sometimes on the site, sometimes not. So people knew where those locations were, so our team actually observed them, took pictures from a distance of those locations, and then just by walking around the community, they noticed the presence of bars where people could obtain alcohol, which we thought was a driver of sex. They observed activities going on in truckers' cabs, at truck stops in the area. You can see there's a photograph on the right-hand side that shows the trucks parked, and if you stand across the stream from those trucks, you can see that activities are going on in the cabs. Festivals were another occasion when men and women would come together, and often drinking would take place, and people would, we observed, go off to the side. There were bushy areas, a local term, where people went off to hide and have sex, and locations where older widowed women sold alcohol and actually supported a sex trade. So all these things we were able to hear about and then actually observe in the community. So maps. Maps, there are many different kinds of maps. Maps are really useful for showing the spatial arrangements of important aspects of a study. So one type of map is a body map. It's actually a cognitive map that requests participants to map their a drawing of a body for particular characteristics. For example, feelings, the location of feelings, the location of symptoms, how they feel about their bodies, different parts of the body that they feel better or worse about. So it's actually a useful tool for addressing emotional factors in a study. Social maps are maps that are constructed by groups of people that are very sort of informally drawn, but they identify important locations, places of events that happened in the past, and routes that people take on their way to someplace important. For example, commercial brothels, or brothels, we call them in our study site in India. Places where commercial sex takes place. The important thing about social maps is that they're not drawn to scale. They're sort of conceptualized spatial renditions of what actually goes on and where key points are located in a community. Other types of maps are drawn to scale, which are very good for survey purposes. And finally, maps can be, of course, GIS generated, and some of these very more informal maps of geographic space can actually be placed on GIS generated maps. So let's have a look at how that works. So in our recent study of alcohol use and sex risk in several different communities on the outskirts of Bombay, we asked people to do a social map of their community. So a number of different groups that were approached in shops and in parks and by the railway station were asked about what was important in their community, important landmarks, the location of events, where the political offices were, and where people gathered, where festivals were held, and anything else that they felt, once they got the hang of it, anything that they felt was important. And then finally, if they didn't raise it, we asked them where people went for drinking and sex, and they included those things on the map as well. So on the right you can see their a kind of a prettied up version of a hand-drawn group map of one particular community whose name has been changed. This is a somewhat more beautiful but less formalized map of another area. Again, the names are all changed. And there, again, you can see things like bushy areas. You can see the main streets. You can see this map is just in the process of evolving. And so you can see directionality. You can see hills in the background. There are outposts, political offices, and so on. All the printing is a bit small, so you can't really see what it is, but they're all labeled. And that one, although the other one is not drawn as much to scale as this one is. So these are digitized maps of the overall study area, moving in from the area itself, which map was available, already digitized, and the locations of the 3 study sites are placed on that, that digitized map, a commercial map. Then a smaller scale map of study site 1, and that map, it's difficult in these communities to actually figure out what the boundaries of the community are, because people don't agree on them, and you can ask 4 or 5 different important key sources what the boundaries are, and they don't really know. The census people know best, but they still don't know. So our strategy in a situation like this is to try to get some kind of consensus, draw the boundaries, and try to place those boundaries on a Google map. And so you can see the Google map and then the actual digitized map above it of study site 1. A second type of data, another type of data collection consists of listings and PILESORTS, which are used to identify and help us to understand cultural domains. So a cultural domain is a class that people understand that includes subcomponents and is cognitive, not behavioral. So types of illness, places people go for help, problems people have, animals that are commonly eaten, barriers to care in a clinic, reasons why men drink. These are all potential cultural domains for which we can get listings, which can then be sorted in various different ways. We can also ask people to, once we have the items in the listing, we can construct them as Likert scales and rate them or rank them, or we can conduct sorting exercises to arrive at cultural consensus, which is the degree of consensus among people in the setting about where they actually place the items under a cultural domain in proximity to one another. And so sometimes we get high degree of cultural consensus. For example, factors that causes of HIV. Right now we might get strong cultural consensus in a community in the US, no matter who we talk to about that. But elsewhere in the world we might have a diversity of opinion, which would appear in terms of lack of proximity among those items in a cultural consensus analysis. So here's an example of a cognitive map, which is a kind of a map of cultural consensus. It was based on listing, free listing in 2 areas, asking, in this case it was 80 people, about things men do and reasons for drinking. And 80 people is actually too many. Generally, you probably would want to only ask 30 or 40 people for a listing. And so the listing is conducted by asking what are the activities that men do in this community. And people usually give relatively short answers for a question like that. Similarly for reasons for drinking. And so the first, people might give 40 or 50 reasons for drinking or things that men do, and that list is then shortened to about 30, and a new group of people, maybe 30 or 40 additional people, are asked to free sort those items. And from the free sort, We use a program called Anthropac, but I think there are SPSS programs that will do the same thing to give you their proximity matrices that produce patterns that cluster. It's like a cluster analysis at the cultural level that cluster these items. So under things men do, you can see that we actually have produced by a program called Anthropac five different clusters: engaging in negative risk behavior, involved in sexual risk, being a responsible partner, being sociable, and being a responsible provider. So those are the ways that men essentially organize their activities in our study communities under those main domains. And these domains are also very useful in constructing surveys. Under reasons for drinking, we have environmental influences, sexual influences, social events, emotions, and tension that are reasons for drinking, and work-related reasons. So from this, it's actually possible to draw a conceptual model and develop a scale, and we actually have taken work from our earlier study and are using it in a current study. We've taken these items and put them in a scale-like format using Likert scales, and the alpha coefficient is higher than any of the other sort of more globally used scales in our study. Here's another result of a hand-drawn, it's actually computer-generated, but hand-drawn cluster analysis of a cognitive map of male-to-male sexual behaviors in Sri Lanka. Here, only 20 men were interviewed, and the degree of agreement in this cognitive map is quite high, and you can see that there are 4 clusters which are really organized in terms of foreplay, kissing, hugging, and so on. Then the next stage is actually physical contact and climax. Galkapanawas is coming to climax between the knees, mutual masturbation, touching penises. And finally, the last 2, which are a little less common, are oral sex and anal sex. So these are the behaviors that are perceived to be carried out by men who have sex with men in Sri Lanka. Now, moving on to another set of materials, we also collect cultural artifacts, which can be many things. Organizational charts that can be used to find out more about the way organizations are really structured. We can look at annual reports for historical data. Photographs are very useful, especially if people know what the photographs represent. They're actually impetus for storytelling about the history of the photograph, the meaning of the contents, and so on. Respondents can take photographs or together with researchers, and those constitute data with the stories that are told about them. Drawings that children do or adults do about issues that are important to them are also important. People tell stories, and the stories are told and retold, and those constitute a form of cultural artifact, especially if they're recorded. Music and the words to music. And finally, objects of value to people in the study. So all of these are important in getting a better sense of what is meaningful to people in their cultural setting. We also use secondary and archival data, including, as I said earlier, including MIS data, clinic or hospital records. Sometimes those are, as we know, filled with gaps, especially if the setting is in a place where the healthcare infrastructure is less strong and fewer resources are put into record keeping. We use census data. We also use data from other studies done at the site if we're fortunate enough to have it, and we use national and international data sets. And those sets are analyzed from whatever perspective is significant to the study to the best of the data set's ability to provide insight. We use many different forms of interviews. I'll just list them quickly, but the important thing is to know that there is not just one type of interview that's usable in a qualitative study. We use key informant interviews, which are interviews with people who are local experts on the topic we're interested in and generally talk about the topic but not about themselves. The interview is about the situation and not about them. So, for example, in our tobacco study of women's use of smokeless tobacco, our key informants were women leaders who knew something about how women in the community used tobacco and where they got it, and shop owners who knew something about the economics of tobacco selling. But none of those key informants talked about their own personal experiences. Now, exploratory interviews with respondents are open-ended interviews in which the interview can be free-ranging. So they're like key informant interviews in that there's usually a checklist of topics, but not every person needs to be asked the same question. So we're still very much in the exploratory stage, guided by our model, but looking to expand our model. Semi-structured interviews are a little more systematic. We are moving here from pretty open-ended to more systematic. And semi-structured in-depth interviews are generally interviews in which people, more representative or a larger sample of people, are asked the same questions to try to identify maximum variation in their responses. So in a semi-structured interview experience, we want to try to maximize variation among respondents, not to find respondents who are similar. So focus group interviews are interviews that are conducted in informal settings. So for example, if someone is in a shop looking at trying to understand how people in a neighborhood purchase food, a group of, say, women shoppers or teenagers might enter that store, and the interviewer might take advantage of the opportunity to just have a discussion with them about what they're buying, why they're buying it, why they come here, and so on. So those can be very comfortable ways of getting access to a group of people that would otherwise be difficult to meet. Focus groups are formal, structured group interviews. They take place with invited people who are invited to participate. Usually the people are should be known to the interviewer, and the research should be sufficiently advanced so that the interviewer, the researcher, knows what questions to ask in the focus group. The idea is to get a clear set of responses to a clear set of questions. So a focus group is not a good way to actually start a study, and nor is it a convenient way, because it's very difficult to know who would actually come to a focus group, especially on a topic that might be somewhat sensitive, if the researcher is not known to the study population. So I would urge for all of you that rush to focus groups to try to put your focus groups at the end. Also use them to improve your instruments, but try not to use them for exploratory purposes at the beginning of a study. Life history narratives, or long interviews with key people that illustrate important aspects about life in a community or life with a health problem, are very time-consuming. They also take a long time to transcribe and analyze, but they can be very helpful in providing case examples, and sometimes can even be the basis for a publication. Brief intercept interviews are those interviews that are done at opportune moments, at bus stops, outside theaters, outside clubs, outside doctor's offices, to ask a short number of questions about a very specific experience. And there's now a growing literature on intercept interviews. People have different kinds of experiences with them. It's important to understand the context of the intercept interview before doing it, because in some cases proprietors don't like intercept interviews on their premises. If intercept interviews are done outside clubs or bars, there could be as people are exiting, problems could arise, the police might be present, and so on. So just be sure that you understand the context when you're doing these very useful interviews. Now, this is a narrative. This is an example of a narrative interview, and I'll only spend a few moments on it, but it was very fascinating, and I suggest for any of you doing drug studies or studies of people who've been involved with HIV for a long time that you and work with networks of people that you try to do this kind of interview. So Chubb was a young drug dealer back in the late 90s. Who was in a very unusual position, first of all, because he was working in the formal sector, actually working in a prison setting and later in a public library, and he was selling drugs. And when we met him, he had developed a drug network at a time during which the major gangs were recruiting and smaller groups and gangs were being forced to coalesce under the larger gang umbrellas. He was able to maintain independent, small-scale networks in the neighborhoods in which he lived. He was a Puerto Rican young man, and he had lived in most of the neighborhoods of the city of Hartford. And so in each of those neighborhoods, he formed networks. You can see the time. The networks had slightly different names. They varied in their composition, but he was able to engage with them, involve them in small-scale marijuana selling, and keep those connections over a long period of time, so that at the time when we met him, he had a distribution network across the city and beyond, and his family was very well connected and was a family of drug dealers, actually, and he himself really was interested only in selling marijuana because he felt other drugs were too risky. But he had a very close godfather, an actual godfather, his godfather, who had a cocaine business. And he had been imprisoned, but asked our key informant, Chubb, if he would take over his cocaine business. So it was very difficult for him to refuse to do that, and especially because he had a citywide network. And so he did enter the cocaine business and eventually was picked up for selling cocaine. Anyway, this kind of network analysis, sort of informal network analysis over time is a very good way of understanding how people forge relationships, how they maintain them, and how they use them. Okay, finally, the ethno-epidemiologic survey. These are surveys built on what we know about the community that we're studying. They can use instruments derived from other studies. Those instruments, especially in cross-cultural settings, often need to be adapted, and focus group settings are one of the very best ways of adapting them. They should be relatively brief. That's difficult for ethnographers. Most surveys that ethnographers put together can be longer than an hour and a half, but usually an hour and a half is the upper limit for a good survey. The questions obviously should be related to the revised and elaborated study model based on the formative data collection. The questions, of course, should be easily understood and in the language spoken by people in the setting. Of course, surveys should be pilot tested, improved, can be improved with the participation of the study participants, at least a pilot group of participants. Obviously should be managed by someone that has quantitative experience can be organized so that qualitative and quantitative questions can be asked in the same study of different data sets and the responses compared and used to supplement understanding in a triangulated data analysis. Just a couple of comments about using cameras. Both video and photographs are useful In evaluation and documentation, you have to remember that permission must always be sought. I have from time to time made the mistake of taking photographs inappropriately, and have been chastised on the street for it, so you would like to avoid that. If the photographs or the video are used for scientific purposes, for education purposes, consent is required, and of course IRB approval is also required. But photographs and video can help people to tell their story, either by telling it in a video film clip, or by using cameras to develop their story through photographs. Sometimes we call that photo voice. Photographs and video can be used to help the researcher tell the story. The researcher, together sometimes with the participants, may take photographs and video, or may do it independently. As I said with the illustration before, the photographs can portray changes, either geographic changes or changes in a situation over time, and different perspectives of the situation. Photographs can document changes in a person's health, in the way the person presents themselves, and again, the emphasis on permission to photograph and to use the photographs for scientific purposes, including publishing. Okay, well, there are many different ways of analyzing and triangulating data. Elaboration of that is probably dependent on another video, but I refer you to Book 5 of the Ethnographer's Toolkit, 2nd edition, for many different ways of thinking about organizing and analyzing, especially qualitative data. So observations are usually in the form of field notes. If they're quantified through the observation, the quantitative data are entered. And we want to use the observations either to show changes, to display events that are going on at a particular point in time in a community, for example, or to show change over time. Maps are also useful for displaying context and for illustrating, for example, how a school is set up, how the ladies' bars that I was describing earlier are organized so that people are channeled to the proper place and they can meet women that they're interested in and find a way to have sex either on or off the premises. And of course, maps can also show change over time. Listings describe cultural consensus patterns and are part of a cultural description of a setting. Cultural artifacts are also part of the cultural and historical description of the setting and provide background data for the study. The in-depth interviews of any kind have to be organized and coded and written up. So generally I like to use an Excel matrix in which I list if there are interviews about individuals, at the individual level, I list the individual. I integrate the data into a text management program and use the matrix to enumerate each of the primary documents, and then itemize so that I have a quantitative description of each of the interviews by code, by the main codes, and also for the demographic code, so that it's very easy to summarize the interviews. Some people actually extract key quotes and put them in an Excel matrix and then find it easy to draw on those quotes when they're writing up their data. Surveys, everyone I think understands well what we need to do to have a clean data set. And finally, cameras and videos should provide visual descriptions of context that are important. Oftentimes they're not clear enough, so we have to be careful to have really clear visual representations. Analytic aids, just a few analytic aids. I like to use Gutman scales and other cultural level scaling techniques that place individuals or groups of individuals. Gutman scale is a kind of cluster analysis within a single domain, and it's very helpful for clustering individuals and providing a cultural script in terms of how the items accrue. Quantifying qualitative data, many people don't like to do, but I find that it's, by that I don't mean applying Likert scale criteria to the presence or absence of data necessarily, although that can be done. What I do mean is counting the examples and noting how frequently they appear when we're talking about themes, because it helps us gain some idea of how important a theme actually is and the presence of counter themes. Maps are, of course, GIS mapping now gives us lots of data with data overlays about communities where risk occurs, and we need to use, all of us should be using computerized data management and analysis packages for qualitative data. So just quickly, one of the things that we can do is to, please be quiet. One of the things we can do is take our main domains and with our data, disaggregate those domains and further disaggregate them in a form of vertical modeling and write up the components in an initial description. And we can do this. Here's an example of how that might be done for youth party culture, where we have different components of youth party culture that can be written up descriptively and then summarized to conceptualize what youth party culture actually means. A data management table is helpful with qualitative data so that we know what kinds of data we're collecting. We plan it initially, but as we obtain more and different kinds of data, we keep track of this table so that we know how we're progressing in our data collection and what kinds of data we're collecting. Finally, an example of a way of organizing data. Stop! This is an Excel spreadsheet that lists approximately 85 different bars and socializing places in Hartford, and it is linked to field notes, site photographs, internet sites, and many other bits of information that allow us to quickly retrieve the raw data above and beyond an Atlas TI or other text management program to get a good representation of the data set and to organize it as well. Qualitative coding is a process that requires a fair amount of attention in a qualitative study. We develop preliminary codes. We also, based on our model, we develop emergent conceptual codes. We refine our codes. We have to pay attention to cross-team coding. Stop it! It's not helpful to me. I'm recording. And we also want to make sure that all team members who are coding understand the meaning of the codes and work out a final coding step. Please stop. Please stop.
I was supposed to do this earlier.
Please. The organizational support for a qualitative study includes staffing, proper training, ongoing project management, a clear project timeline, ongoing attention to ethical issues as they arise in the field, and continued attention to budget revisions. Ethnographic research is not for everybody. It requires good communication skills, participant observation capacity, that is the willingness to get into a community, to feel comfortable in settings that are unfamiliar, and to engage with people in those settings to learn something about them. It calls for the capacity to live or to spend time in difficult or different circumstances. It requires the capacity to suspend judgment, so if your convictions are firm, probably this isn't the approach for you. It requires the capacity to leave disciplinary or other biases behind. And it takes a lot of time, both for data collection, transcription, organization, and analysis. And finally, it requires looking first for differences and the reasons that account for them, and then for similarities and why they exist. This last slide gives you the key components of a proposal outline, and I suggest that you read it from left to right. The question on the right is the question that needs to be addressed in each of the components on the left, which are the components of a typical proposal. So, for example, the introduction needs to describe what the study is about. The argument needs to describe why the study is important, and to convince the reader that the literature and the setting and rationale for the study is important, and so on. So with that, I end this presentation. Good luck with your work, and I look forward to hearing about it in the future. How do I turn this off? If I didn't record, I'm going to shoot.